Thank you. First of all, I'd like to thank the organizers, PTMS, and particularly Kibble Sim, I hope I pronounced that correctly again, for the privilege to join you here today. It's always great to be back in Istanbul. I love the place. I've been following and studying healthcare professional social networks for about 9 or 10 years. And in a way, they parallel the growth of private social networks such as Facebook, very similar, but nothing like on the same scale. But their impact on medicine and the way that the pharmaceutical industry communicates with the medical profession has been very profound. So in my presentation, I want to just cover the history of social networks, these types of social networks, and bring you up to speed where we are today, and then look at some of the new developments in the way that these networks are being used in public health. Before I start, just a reminder of what they actually are, so we all understand. These are professional social networks only for doctors, so the credentials of members are checked. Doctors talk to doctors. Why do doctors like them? Why do they use them? Well, it varies from country to country slightly. These are the main reasons, but the most important reason is that doctors like to be in communities where they know they're only talking to doctors. It's a trusted community. That's really, really important. So I'm going to cover 3 areas. I'm going to be talking about the global dimensions of this phenomena. Then I'm going to look at the new aspects related to health reform programs, national health reform programs. And then I'm going to look at the very new aspects that have arisen this year in pandemic threats. So let's start with the global dimensions. Really, this whole phenomena started about 9 years ago, 2007, when a network in the USA was launched called SERMO. And it's been growing steadily over the last 9 years. So we reached the point today where there are at least 140 networks representing membership of well over 7 million healthcare professionals. That's doctors, nurses, medical technicians. If you would just look at the numbers of doctors involved, then it comes down slightly to about 5.5 million. Numbers are going up steadily. What's really interesting is I need to check my time here, because I don't see a clock. Someone's going to warn me now, I can see here. Okay, that's a countdown. You can see here that the vast majority of members are in the Asia-Pacific region. It's not surprising, and you'll see later on why that's so if you look at the membership numbers in countries like China and Korea and Japan. But growth in the rest of the world is also very, very substantial. So I'm just going to touch on some of the major regions and give you a feeling of what's happening and what's happened in the past. Look at the US. This is where it all started, and I describe it as only the paranoid survive. This is a phrase from Andy Grove, who was the CEO of Intel. This is a market that's dominated by a very, very thriving high-tech mentality, a startup mentality, and venture capital, an abundance of venture capital. And this market continues to develop very rapidly. And they're also now, in this year, beginning to think globally for the first time. These are just some of the networks, at least 20, 25 there. I can't list them all, but a substantial number. Some are extremely specialized. One, for example, Spine Connect, is only for spinal surgeons in the USA. 2,000 of them, but they're all members of this network. The very first network that was launched was called SERMO. It was the very first healthcare professionals community. Pioneers in many, many ways. It was the first to develop the types of services for doctors, but also services and business models based on partnerships with the pharma industry. And right now it has about 500,000 members globally, and I'll come back to the global membership a little later on. Remarkably, this network was overtaken in membership in the USA last year by a network called Doximity. And this is remarkable for one reason. Doximity has only been around for 4 years. And Doximity came in and in 4 years, it took over majority membership in the US. It's now got 2/3 of all doctors as members. And what it understood was that doctors really do like to use their mobile devices. So all of its services were based around the use of mobile devices. And it also offered secure communications possibilities based on the USA HIPAA regulations. Turn to Europe. Quick look at that. Europe is heterogeneous. No surprises here. Everything's different in Europe. It's remarkable also because there is a very big divide between Scandinavia, the Netherlands, UK, Germany, and countries such as France, Italy, and Spain. The northern countries are far more advanced than the southern countries. But we also see on the eastern side of Europe huge growth from the Central and East European countries. In these markets, we have something like 33, 35 networks at least. But this region is also one that's driving global alliances, and I'll come to that in a moment. These are just some of the networks. If I add them all up, if I look at all of the Western European networks, Central and East European networks, and Russian networks, and networks in Turkey, of course, we get to a number that's well over 60. The largest in Europe by far is Doctors.net in the UK. What has it got? I think 215,000 members according to latest stats, and they've got membership of about 90% of all UK doctors. What's remarkable about this network is, first of all, it was acquired by the Japanese group M3 a couple of years ago, but it was instrumental in driving global alliances. This is not a global network, but it's a global alliance of networks, something like 24 individual networks are in the alliance right now. And what this does is enables pharmaceutical companies to drive campaigns to the medical profession much more easily across multiple markets. And this is becoming very effective. And as I said, Turkey is in this network. The Turkish network, and I'm sure you're all familiar with this one, is Dr. Sitezi. I got to know the founder of this many years ago. It was launched as a portal in about 2004, then relaunched in 2011, bringing in patients to the community so that patients can connect with doctors. And it really serves all stakeholders in the healthcare industry in Turkey. And the other quite remarkable thing about it, its business model is quite unique. It's really based around delivering teleconsulting services via the internet. This is very, very rare in the world. So let's have a look at the Asia-Pacific region. I can only describe it as turbocharged. If you look at the numbers and speed, everything's big, everything's fast, or a combination of both. Here are just some of the networks. As I say, if you look at the networks across China and India and Japan and Australia and New Zealand, there are many. These are the ones that are most well known. I can't talk about them all. I would need a separate presentation to talk about networks in China and Korea, but I can only focus on one. It's going to have to be China. And in many ways, these networks, they are the largest. In many ways, they are the most innovative. I'll pick out one that I'm most familiar with. I know the founder of this one. Actually, the founder of this was an ex-CEO of Bayer. It has over 2 million members currently, and it serves, as you can see, hospitals and health centers. It focuses on delivering services to rural areas, and it services all the stakeholders in the Chinese healthcare system. What's interesting is the composition of the membership. I said 2 million members, but from those 2 million members, only 50% are doctors. And the rest are made up of nurses, medical technicians, and pharmacists. And in China, it's quite normal, and it's expected that healthcare professionals communicate with other healthcare professionals. And that includes healthcare professionals from the pharma industry. This is quite different to other markets, particularly in Europe and the USA. But the China model and the Chinese expectations are very similar to those in markets such as Russia as well. Now, I'll mention one other region where things are not quite so rosy, and that's the Middle East and North African region, and Africa as a whole. This is the only region in the world, and it has been really for the last 10 years, without any national or regional networks. Last year, there was an attempt coming out of United Arab Emirates to drive a network, but it failed. It lasted for about 3 months, but it made all the classic mistakes that healthcare professional networks can make. And the relevance of that will become clear when I start to talk about pandemic threats. So let's look at some of the new stuff. And the first one I want to address really is health reform programs. Many countries have healthcare reform programs, including Turkey. The Turkish health reform program, if I understand it, is called the Health Transformation Process, HTP, could it be? Putting people first. And from what I can see this year, the emphasis has been on governance, efficiency, and delivering quality in healthcare. So it's very relevant to the Turkish situation. Now, I've been following what healthcare professional social networks have done in other countries, and really, if I summarize those benefits, it amounts to 3, basically. It accelerates dissemination of medical expertise. One of the prime reasons for doctors to use these networks is to seek a second opinion on diagnosis and treatment. So it serves a wonderful purpose in providing a platform for doctors who are experienced to pass on that experience to less experienced doctors. And extending that benefit, it also then is a huge benefit in extending the expertise from urban to rural areas. And this is a goal of many country health reform programs. In many countries, there's a deficit of healthcare professionals in the countryside, in rural areas, and there's a surplus of this expertise in urban areas. So it helps to support that extension of expertise. These networks are also used extensively for continuing training, continuing medical education initiatives. It's a goal of just about all of the countries that are running major programs. And obviously these CME initiatives can be provided online. All of this leads really to 2 major benefits for health reform programs, and that improves for the patient, better health outcomes, and for the service being delivered at national level, it lowers service costs. I want to just give you 2 national quick examples of how this works in practice. Come back to the Haiyuishing website. Haiyuishing, which means the good doctor, by the way. It's been around for a long time, launched in about 2000. But when the Chinese launched their healthcare reform, they've had one for about 10 years, they are in the process of spending $1 trillion. That's $1 trillion on healthcare reform. They made a move to really support and align its services with the goals of the Chinese healthcare reform. So what it does, it delivers currently 1 million CME modules a year, and they're all based on evidence-based medicine. Most of the modules come out of Europe or the USA, and what this does, it helps the Chinese healthcare reform shift from traditional medicine to evidence-based medicine, and they've been very successful in driving this model. And of course, the pharma industry here plays quite a huge role in sponsoring a lot of these modules. I'll come to one other example, which is closer to Turkey. This is in Saudi Arabia. Last year, I was invited to Saudi Arabia to talk about healthcare professional social networks and the role that it could play in the Saudi Arabian health reform program. You may or may not know that Saudi Arabia has an ongoing health reform program. It's a country in which people lead very unhealthy lifestyles. At least 26-27% of the population has diabetes. Population growth is enormous. It's due to double in the next 30 years. And there is no healthcare professional social network, and very unlikely to be one from what I can see. So I was researching this and talking to potential developers, and we saw there was quite an opportunity for a public-private partnership to create a network for healthcare professionals that could actually be tailored to support the goals of the Saudi Arabian healthcare reform. So this has been presented. You can see some of the features that we discussed last year. We haven't moved ahead on that, but it's still up there for discussion, and I hope we'll come back to this topic later on next year. So I now want to move on to pandemic threats, which is new. This is really new. To understand pandemic threats and what it really means, and in the context of healthcare professional social networks, I want you to just think back again to 2007, 2010. And when the first networks were launched in 2007, 2010, there was a lot of discussion about global networks. Will doctors want to be global? Do doctors in one country want to talk to doctors in another country? And there were a lot of surveys conducted. I spoke to a lot of doctors, and as I say, surveys were conducted. And what we learned was that doctors basically said, no, we really want to talk to doctors in our own social in our own country. We're only interested in national networks. And the reasons given were fairly easy to understand. They liked talking to doctors in their own country because they had the same health priorities. Doctors in Western countries said, well, we're not quite so interested in talking to doctors in developing countries because there the focus is much more perhaps on infectious diseases. And here in the developed countries, we have problems of obesity and such like. So there were different health priorities. The other reason was the health systems. Doctors like to talk to other doctors who are working in the same health systems. Everyone's going through health reform programs, so they like to discuss the same health issues. And there were, of course, the language issues. So basically we said, it's probably not going to be, it's not going to be happening. But in the meantime, what's happened? We've seen increasing emergence of pandemics. And we've seen, with increasing regularity, the emergence of new pathogens. New pathogens are emerging at an increasing rate. And the really scary thing is that these pathogens are able to travel around the globe at jet speed. There's been a recent study that's just come out analyzing how fast a pathogen can travel from one airport to the next and to the next. And I'm thinking here in Istanbul, in a couple of years, you'll have the world's biggest airport, not very far away from here. And that might have some major implications for contagion. So there's a lot to be considered there. So what we've seen with these pandemics, and particularly with Ebola, is that these pandemics have no borders. And if you think about Ebola, what happened there was that we had a pandemic that spread across 6 African countries, 6. It infected 28,000 people, and 11,000 people died. These are serious numbers. And these are things we have to take very, very seriously. But at the same time, we've seen in the last couple of months a report that's come out of the Harvard Medical School and the London School of Hygiene and Tropical Medicine, which condemned the World Health Organization. It was published just recently in The Lancet, and there were very, very strong words used. And this is a quote here from the director of the Harvard Global Health Institute. He said the most egregious failure was by WHO in the delay in sounding the alarm. Egregious is a word you do not use very often in English. It's very, very strong. And basically what they discovered was that the World Health Organization, and if you know about the World Health Organization, they're in Geneva, They knew about the first outbreak in spring 2014, and they only sounded the alarm in August, 5 months later. Action was taken another 2 months later, that's 7 months later, towards the end of the year. So there was a 7-month delay before anything was done. And meanwhile, there were 11,000 deaths. So there's something wrong there, and it's been identified as a major failure of the World Health Organization. So I've been talking to some experts in disease forecasting, and one of them is Dr. James Wilson out in the University of Nevada. And basically, he's identified and said that what we need to do is to decentralize information flow. Because right now, there's no connect between institutions, health institutions such as the World Health Organization, and doctors on the ground. Doctors really at the front line of healthcare. And this is where major advances could be made. So what's happened this year? What's really interesting this year is that we've seen the launch in America from Sermo, who launched the very first network in 2007. They have launched a global network. Cross-border peer-to-peer is actually here. Now, I've got no commercial connections to Sermo, I'll say that right now. But I do communicate with them a lot. But what they've done, they have launched a true global network in, 16 countries here for the first time. And what they've attempted to do here is to make pandemic forecasting part of their business model. And they're partnering with some of the world's leading disease forecasters to make sure, or to see whether the doctors at the front line of healthcare can talk to other doctors at the front line of healthcare right away if there's any suspicion of a pandemic. And I think this is very commendable. It could, of course, these types of networks could be created by other healthcare professionals' networks too. If you remember the one I mentioned before, the Alliance that was driven by Doctors.net in the UK, that could also become global. But here we have a network in place, and as I say, it was launched this year. So you might ask, well, will doctors use it, given what we know about their preferences in 2007 to 10? Well, Sermo launched a survey, and I've been talking to some doctors as well, and things appear to have changed. Okay, the Sermo survey was amongst his own doctors, so you might say it's very biased, but it was with 13,000 doctors, I think it was, and basically they're saying that attitudes have changed very positively. So it gives me confidence that, that doctors now are beginning to think a little differently about the whole issue. And last month, I live in Germany. Last month I went to a conference in Berlin, and I met a lot of doctors there, and we were talking about this very issue. And they were concerned about the risk of infection from refugees coming to Germany and parasites, new parasites being brought into Germany. And they were very enthusiastic about using global networks in the future. Sermo now posts a number of examples of how its network is being used by doctors to solve cases, and how the global community is now helping to do this. This was a case it posted recently. A Canadian doctor looked at a very severe case of E. coli poisoning in a young girl, reached out to the community, and you can see here there was some very significant response, a sort of global crowdsourcing in action, where over 1,200 doctors around the world looked at the case, and there were 46 responses. And ultimately, the solution and the diagnostic and the treatment was based on input from a doctor in South Africa. So I think there are really three main reasons for how and why healthcare professionals' social networks can in future play a pivotal role in pandemics. The first thing is they decentralize information. Doctors at the front line in one country can talk to doctors in the front line in another country. They can increase resilience. We don't depend, or they do not depend on a single source of intelligence. It means that doctors can talk to one another, and depending on, it really makes the whole system much more flexible. And the other thing that's really important, it eliminates politics. And what has been discovered within the World Health Organization is that politics played a very negative role because the bureaucrats, if you like, who were sitting in their cozy offices in downtown Geneva were not very comfortable about alerting and taking action until they were 100% certain that things were as they should have been. So they just waited. So this removes politics from the alerting mechanism. So finally, I'll conclude on, again, a quote here from Dr. James Wilson out there in the University of Nevada. And he's convinced that healthcare professional social networks in the future, in the face of the next global crisis, is going to be of the utmost importance, as it could, or as they could be the key to saving lives on a truly massive scale. And on that thought, I'll close. Thank you.
Len'i her zaman bulamayacağımızı varsayarak eğer sorularınız varsa kendisini almak isterim. Buyurun. Arkadaşımız mikrofonu veriyor size.
Hello, thank you for an excellent presentation. I have a question. I know you were here to talk about networking among doctors, but I'm just going to talk in a minute about the importance of the marriage of the lab with the clinic and how the distinctive line between clinics and research is getting more blurred. So wouldn't the doctors also be interested about talking to non-doctors, research institutions, the real data that is being generated, that is creating this disruption in healthcare as we know it? It's actually not coming from the clinic anymore, it's coming from the lab.
Yeah, great question. And there are a lot of lessons to be learned from the likes of China and Russia, where the networks there from day one have integrated all healthcare professionals. And when you talked, I've been to China, I've been to Russia quite a few times, and when I talk to healthcare professionals of all types there, they say, of course, we all need to talk to one another. Why would we want to work in silos? So I think there's a lot of work that should be done to encourage networks in the West to do the same. Absolutely. And I know one of the healthcare professionals groups that I know there's a network that's actually working on is to involve pharmacists as well. It seems to be obvious that pharmacists should be brought in much more strongly. I'm sorry?
Also patient organizations, because as pandemics are important. For instance, in Europe, now there is an initiative for rare diseases. And in case of rare diseases, networking is the only tool to have access, to that one doctor that knows about this disease that you see in like 1 in a million people. And that doctor has to be reached not only from Europe, but maybe from Russia or maybe from Singapore. And there, the patient organizations have actually paved the way to have these functional networks of the doctors, the research, and the patients and their families as well. So networks are good because then you can join networks with other networks.
Well, that's a good point, but there is a but. The but is, I think I mentioned on my first slide, that one of the reasons why doctors come into these networks and are very favorable to all these networks is that they enjoy the peer-to-peer communications. They feel much, much less comfortable if they believe there are patients in there. Now, many doctors in the world, and particularly in the US, are starting to use public social media. You will see, I know many doctors are using Twitter, for example, and they're reaching out to patients, talking to patients, but they will not say many things on public social media that they feel quite capable of doing in private, professional social media. So I hear what you're saying, and I think there's a way to do that, but I don't think you will have patients mixing in with doctors in the type of discussions that currently take place on healthcare professional social networks. I mean, you have here in Turkey, you have Dr. Sitezi, and that is a model of how it could work, and I can see that expanding quite a lot. But even in China and even in Russia, you don't have patients being allowed into the networks. It's only for healthcare professionals. So there's probably a business model in there somewhere, but right now, I don't know any healthcare professionals network owners that have actually accomplished that.
Thank you. Is there, başka sorumuz var mı? Bilemiyorum. O zaman izninizle. Thank you very much,
Okay,
Len.
thank you.